Thank you. So it's my pleasure to be here with you, even in distance. And thank you, Evie, for a nice presentation. And it's good news that our students, yours and ours in Lithuania and in Estonia, have quite good condition of health. I am glad to say that. And today I would like, well, maybe to say about me a little bit. I am a lecturer at Klaipėda State University of Applied Sciences. And today my topic is Tai Chi for mental and physical health. And I would like to share my screen. Don't know if it's, can you see the screen? Yeah. Okay. Thank you. So Tai Chi exercises. I fell in love with this system of exercises 5 years ago, and I'm keeping on with my love. And I would like to share some knowledge and experience with you. But today I'm going to present a literature review of Tai Chi exercises effect of physical and mental health. So a little bit about Tai Chi. What is this? Probably, maybe, and you have these exercises in Estonia, in Tartu, but mainly it came from Eastern countries, like traditional Chinese exercises and mind and body exercises. So it takes mind and body training, involves sequences of flowing movements, sort of like dancing movements. It's slow movements. And one of the very important focus is mental focus. So you have to keep your attention, mindfulness, to be at the present moment. Also involves breathing, coordination, and relaxation. The main goal of the Tai Chi exercises to get rid of tension in the body and to let the vital energy of Qi to flow freely in our body. Because nowadays we experiencing a lot of stress. Our life is stressful and muscles react to our stress. And then our cells of the body are lacking the energy, and the body cannot work properly like organism. So Tai Chi helps to free that energy. And I am going to just to show you some findings, scientific literature review findings, and I took the most newest meta-analysis and systematic reviews. So first of all, maybe on physical health. So here is 2019 article of systematic review and meta-analysis where 17 randomized controlled trials were involved. And the findings suggest that Tai Chi can be, and Qigong. So there are two types of exercise, but they are from the same group, like mind and body exercises. They are very similar. So I looked and found that many articles together combining those Tai Chi and Qigong in the same group. So is beneficial for symptomatic management of chronic lower back pain, in particular in reducing pain. Then fall prevention. It's also very important to our nowadays life, the falls, because it's a big burden to healthcare system. And the age of life expectancy is increasing, so it's good, but also if it's good to have good quality of life. So here it's 2020, the newest meta-analysis, and 29 randomized controlled trial involved in this analysis, and it took healthy older adults. The conclusion was that those dance-based mind and motor activities were associated with decreased risk of falling and rate of falls. At the same time, because that is correlating, improved balance, mobility, and lower body strength. So this activity may be useful in preventing falls in this population. Cardiovascular system, the first leading diseases on mortality and morbidity rates. So again, it's good news in this field. And also the newest 2020 meta-analysis suggests that Tai Chi can lower blood pressure, total cholesterol, triglycerides, low density lipids, cholesterol, and blood glucose, and increase significantly quality of life in adults who have essential hypertension. Respiratory system. Here, the meta-analysis and systematic review took the patients of chronic obstructive pulmonary disease, and they looked to the Tai Chi effect on physical and mental health, and they found that Tai Chi improved some lung function, enhanced 6-minute walking distance score, chronic respiratory disease questionnaire score, and mental health status. And it can be alternative or complement to standard rehabilitation programs for those patients who are suffering from that chronic obstructive pulmonary disease. The next, our issue of health is sleep quality. We all know that how important to have good sleep quality. And again, the stress is around, so it's people having big problems with the sleep. They are not getting enough sleep, and if you have short sleep hours and bad quality, so it comes to the big issues of health. 2019 meta-analysis with quite big participant numbers, like 4,506 participants, and big amount of studies, so 49 studies took that meta-analysis, and they concluded that mind and body therapies can be effective in treating insomnia and in improving sleep quality for both in healthy and clinical patients. Cognitive function. As I said before, and we know that fact that the people life expectancy is increasing, so we would be good to have, it would be good to have that cognitive level also good like physical level. So here in this article, there were less studies, it's 9 studies, 6 of them randomized controlled trial, and it was looking for the cognitive function in elderly of early stages of dementia. And also it's promising that Tai Chi can improve short-term cognitive function in elderly at the onset of dementia. Immune system. Now it's very actual system to work because we have that situation with the virus. So we have perfect system, defense system. So we need to keep that system in good shape. So Tai Chi and Qigong, again here in this article, 2020, quite again new and big, quite 19 randomized controlled trial with a big group of participants. And they stating that those exercises has a significant effect of increasing the levels of immune cells, but not significant effect on reducing the levels of inflammation, so C-reactive protein and cytokines. So again, beneficial effect, autonomous nervous system. Here the article is 2018, but again it's 3 years old or 2 years old, 2 years old, yeah, probably. Here they look to the heart rate variability because it's that parameter which reflects the autonomous nervous system. And and the meta-analysis showed significant beneficial effect on heart rate variabilities, parameters, and stress level. And it could be a good alternative method for stress management for people who live under high stress or negative emotions. So for everybody, I think it could be useful. Anxiety and depression. In this article, they were looking for the individuals with substance use disorders, how Tai Chi affects exercise, Tai Chi and Qigong exercises can affect depression and anxiety symptoms. And again, here suggestion that beneficial effect of Tai Chi and Qigong exercises on symptoms of depression and anxiety among individuals with drug abuse. And here in the last article, it's not a meta-analysis. I couldn't find any meta-analysis, but it's also informative article where the study was conducted in 2017 and 2019. Many patients and many caregivers, 184 patients and 120 caregivers were participating in this study. And we all know that it's the second cancer is the second disease after the heart, cardiovascular system, which with the numbers of mortality and morbidity. And it's when we have patient with the cancer, so it's not affecting only patient, but also and family members, friends. So for caregivers also, it's important to keep the good as possible the health status. So here they looked to the effect of center-based delivery of Tai Chi and Qigong group classes of self-reported symptoms in cancer patients and caregivers. And it was satisfied overall and experienced significant improvement in global distress. So in conclusions, Tai Chi practice is low impact, moderate intensity aerobic exercises, suitable for a diverse patient population with regards to gender, age, and health status. It is safe, cost-effective, non-pharmacological practice. Scientific research always requires good methodological quality. So in every article which I looked, the last sentence nearly looked like this: that due to poor methodological quality, more clinical trials with larger sample size, strict randomization, and clear description needed to further strengthen evidence. But of course, we do as we can. It's every scientist know how it's difficult to make that very good methodology quality of randomized controlled trials. And for the last, my message, I would like to share with you the Tai Chi wisdom, sounds is like, be like the sea, who is lower are always calm, no matter what happens on the surface. So it's very suits for nowadays time. So thank you for your attention, and I am happy to answer your questions if there are some.
Thank you very much for pretty interesting and deep presentation you shared, and the knowledge which is from one side scientifically broad and from other side absolutely needed now for us on a nowadays situation. Thank you very much.
Thank you.
So can we just make an applause as well? And now I switch back to Estonian. Thank you, Roberta, and stay safe, and all the best regards from Tartu to Klaipėda.
Thank you very much.
Thank you.
Bye.